Thank you. Very interesting discussion, and I think we need to put it in context of where the world's at. Dr. Stop, is that right? Are you from Texas?
I am from Texas.
Amanda's situation was terrible. What happened in Texas?
You know, Amanda, I want to say I am so sorry at your loss of Willow, and I am so sorry that your doctors misunderstood Texas law. I've reviewed Texas law, of course, because I practice there and I want to understand, as well as all of the other laws in the states. Every single law allows an exclusion for a doctor to use their reasonable medical judgment to determine when to intervene in a medical emergency, which is usually defined as a threat to the life of the mother or permanent irreversible damage to an organ or an organ system. None of the states have the terminology that the threat must be immediate. Doctors know, and we obstetricians have always known, even prior to Dobbs, the Hyde Amendment has been in place since the late 70s, and the Hyde Amendment allowed an exclusion for life of the mother. So doctors have been practicing, and I have not changed my practice in any way since the Dobbs decision. The American College of Obstetrics and Gynecology, in regards to the horrible situation that Amanda found herself in, pre-viable, premature rupture of membranes, where the water bag breaks, but labor does not ensue, and the baby is a long way from being able to live outside of the mother, the American College acknowledges that the risk of infection is high, which can become sepsis, which can threaten the mother's life. The likelihood that the baby can make it to an age in which it can live outside of the uterus is very low. And they tell us, and obstetricians do follow ACOG's recommendations for the standard of care, they tell us at the time of diagnosis that we should offer immediate termination of pregnancy, which they define as induction or dilation and evacuation abortion, or expectant management. So in a woman who is not currently infected and sick, I have had patients who have wanted to stay pregnant in hopes that they could get the baby to a gestational age where it could live, but it has always been the standard of care and continues to be the standard of care to offer delivery at that time. Most of my patients have opted for induction rather than D&E because they wanted to have a baby to mourn, but either one could have been offered and should have been offered to Amanda.
Thank you. 15 weeks. Is it fair to say that baby has a heartbeat at 15 weeks? Does anybody on the panel disagree with that? As a matter of fact, the baby has a heartbeat about 2 months before 15 weeks. Is that right, Dr. Stoke?
23 days after conception, there's a muscular chamber innervated by electrical impulses pumping blood cells, which are oxygenated throughout the baby's body.
Does anybody disagree with what I said about the European standard that 47 of 50 European nations limit elective abortion at 15 weeks or less? Does anybody disagree with that? Good. The bottom line is 55,000 babies are aborted after 15 weeks in the United States. Is that right, Dr. Verberhurst?
That's correct.
And most are elective, so this would matter. So I'm for my bill. I'm not asking you to be, Dr. Stoop, but I'm for it. And let me tell you why I'm for it. I'd like America at some point in time to say, 15 weeks being pretty good to me, that a baby is well developed, can feel pain. You can't operate on the baby medically without anesthesia because the baby can feel pain in efforts to save its life, to draw a line. There's nothing unreasonable about trying to draw a line at 15 weeks when 47 of 50 European nations do that, with exceptions for rape, incest, life of the mother. What's unreasonable is allow abortion on demand up to the moment of birth. That's exactly what your bill does. that puts you in the category of China and North Korea. I welcome this debate. We're not going to back off. We're going to try to have America in line with the civilized world, not North Korea and China. Nothing good comes from wholesale abortion on demand at 15 weeks when the baby can feel pain.